There is a window of time that occurs every single morning, usually between 400 and 1600 a.m. That is the most dangerous period of your entire life once you pass the age of 60. You are lying in bed, the world is quiet, and you believe your body is resting. But for many of us, our internal systems are actually fighting a silent, uphill battle just to keep our brains alive. What I am about to tell you is something most doctors won't say out loud because the institutional medical system simply doesn't have the time to look you in the eye and explain the mechanics of your own survival. We've been taught that health is about the big things, the major surgeries, the heavy prescriptions, the radical diets. But after decades in clinical practice, I've realized that the difference between waking up refreshed and waking up in an emergency room often comes down to the smallest, most human choices we make before we even close our eyes at night. One of those choices is how you position your body during sleep. If you are over 65, there is one specific sleep position that could be quietly sparking a catastrophic event in your brain while you dream. My name is Dr. Samuel, and if you value your independence, your memories, and your mental sharpness, what we're about to discuss is non-negotiable. Today, I'm going to show you exactly how this sleep position acts as a trigger for strokes, why your morning glass of water is actually a life-saving tool, and which healthy vitamins in your cabinet are secretly turning your blood vessels into brittle stone. The mechanics of the kinked hose. I want you to picture someone like Arthur. Arthur is 69 years old, he's active, he walks his dog, and he's doing everything by the book. But inside Arthur's body, his biological battery is no longer at 100% now. His brain's ability to clear out toxic proteins has slowed down, and the blood flow to his thinking centers has already naturally dropped by nearly 15% dump. One night, Arthur goes to bed in a position he's used for years or flat, on his back with his head twisted sharply to one side. To anyone else, he just looks like he's sleeping deeply. But because Arthur is over 65, his pipes, his arteries, are not what they used to be. His carotid arteries, the main highways of blood to his brain, have become rigid and stiff. When he twists his neck in that specific way, he's not just sleeping, he's mechanically kinking a hose that is already narrow and inflexible. This is compounded by the fact that by the time you hit your 60s, your blood vessels have lost their elasticity and may even feel like cutting into bone. When you combine that mechanical kink with thickened blood, a result of not having a sip of water in 8 hours, you create a perfect storm for a stroke. The sludge problem, why your blood thickens at night. Most of us think of high blood pressure as a plumbing issue, simply too much fluid in the system. We take diuretics or water pills to flush that fluid out, thinking it solves the problem. But here is the betrayal nobody tells you. When you take those pills to protect your heart, you are often starving your nerves and thickening your blood. By the time you reach 65, your sense of thirst is dramatically impaired. Studies show your thirst response can be delayed by up to 90 minutes after your body actually needs water. You could be medically dehydrated without even feeling slightly thirsty. When you sleep for 7 or 8 hours without fluid, your blood literally becomes thicker. Think of it like a garden hose. If the water is thin and moving fast, the hose stays clear. But if the water turns into thick mud, and then you kink the hose by sleeping with your neck twisted, the pump, your heart, has to work twice as hard to push that sludge to your brain. This dehydration makes your cell membranes rigid, like a dried out sponge. A dried sponge can't absorb anything, and similarly, your dehydrated cells can't properly process insulin or glucose, causing your blood sugar to climb while you sleep. The rust in the pipes. How vitamins turn arteries to stone. We have been told for decades that if we want strong bones, we must take calcium supplements. But after 60, your body's GPS for calcium starts to malfunction. When you're young, your bones are like sponges that soak up calcium. But after 65, that hormonal signaling weakens. If you take a standalone calcium pill, that calcium doesn't know where to go. Instead of going to your hips or your spine, it lands in your pipes, your arteries. It starts to harden the inner lining of your blood vessels, a microscopic layer called the glycolix. Think of the glycoalix like the non-stick coating on a frying pan. When it's healthy, your blood slides through effortlessly, but when you rust that coating with excess calcium and oxidative stress, it becomes sticky. LDL cholesterol and inflammatory molecules start to snag on the walls, leading to calcification. This is why when I perform surgery on a 70-year-old, their artery can feel as hard as bone. If your arteries are stone and you're sleeping in a position that compresses your neck, there is no give. The vessel cannot expand to accommodate blood flow, and that is when a piece of plaque can break loose, traveling straight to the brain. The TEVs. In your medicine cabinet, it makes me frustrated as a physician to see seniors trying to be proactive, only to take supplements that increase their stroke risk. Vitamin A, retinol. After 60, your liver slows down and can't process fat-soluble vitamins like it used to. Retinol begins to accumulate in your tissues. A 2022 review showed that seniors with elevated vitamin A levels had a 25% higher risk of atrial fibrillation, A5. AFib creates an irregular heartbeat that allows blood to pool in your heart, forming clots that can lead to a stroke. Iron, unless you have a diagnosed deficiency, extra iron after 60 doesn't give you energy, it just rusts your organs. It creates oxidative stress that ages your tissues and has been linked to higher rates of dementia. High-dose vitamin B6C, while marketed for energy, taking more than 50 mg a day as a senior can actually be neurotoxic. It poisons the very nerves it is supposed to protect, leading to tingling and numbness that mimic normal aging but are actually signs of toxicity. The brain drain. Fruits. Why sugar spikes matter? You might think that fruit is always a safe choice, but for an aging brain, certain fruits act like sugar bombs that trigger inflammation. When your blood sugar spikes above 145, it strips away that protective, non-stick, glycoalix coating in your arteries. Fruit juice. Drinking orange juice is not the same as eating an orange. In juice form, the sugar from 3 or 4 oranges hits your bloodstream in minutes because the protective fiber has been removed. Daily fruit juice consumption has been linked to measurable brain shrinkage in the hippocampus, the memory center of your brain. In people over 60, dried fruits, raisins, dates, and dried mango are nature's candy in the worst way. The drying process concentrates the sugar to levels your aging brain cannot safely handle. A single handful of raisins can contain more sugar than a candy bar. Canned fruit and syrup. These are often packed in high fructose corn syrup, which triggers massive insulin surges that cross into the brain and lead to foggy thinking and memory retrieval issues. The protocol. How to stroke-proof your life. I don't want you to live in fear. I want you to live with understanding. When you understand how your body behaves, you stop fearing it and start managing it. Here is your roadmap to reclaiming your health. 1. The sleep alignment rule. If you wake up with morning fog or a headache, your brain is likely starving for oxygen. Stop sleeping flat on your back if you snore, as this often signals sleep apnea, which spikes your blood pressure overnight. Instead, sleep on your side with a supportive pillow that keeps your neck neutral. Previous chat context. Keep your neck highway open. Previous chat context. 2. The WTR protocols, water, timing, regulation. The most fundamental thing your body needs is strategic hydration. Window 1. Immediately upon waking, drink 12 ounces of room temperature water. Do not drink it ice cold, as this constricts your blood vessels and can trigger a stress response. Window 2. Add trace minerals, specifically magnesium, back in your water. Minerals are the keys that unlock your cell doors so the water can actually get inside. Magnesium is involved in over 300 reactions and helps keep your heart rhythm stable. Window 3. Drink 8 ounces of water exactly 30 minutes before each meal. This slows gastric emptying and creates a gentle rise in blood sugar instead of a sharp spike. 3. The unstiffening vitamin duo, K2 and D3, to get the calcium rust out of your arteries and back into your bones. You must use the combination of vitamin D3 and vitamin K2's MK7 form. Vitamin D3 increases calcium absorption. Vitamin K2 acts like a traffic controller, directing that calcium away from your arteries and into your bones. Studies show that participants with high K2 intake have significantly less arterial calcification. Take these with a meal containing healthy fats, like avocado or eggs. to increase absorption by 50% in the 4. The nerve repair, benfotiamine, if you feel that burning needles sensation in your feet, your nerves are sending a distress signal because their insulation, the myelin sheath, is fraying. Standard vitamin B1 won't fix it because it is water soluble and bounces off the fatty nerve tissue. You need benfotiamine, a specialized fat-soluble form of B1 that soaks directly into the nerve to patch the insulation. Take 150 mg to 300 mg in the morning with healthy fats. Within weeks, many patients find that the burning pain quiets as the nerves begin to reconnect. 5. The protective 5. Fruits instead of the sugar bomb. Fruits. Reach for these everyday guardians blueberries. They contain anthocyanins that cross the blood-brain barrier to reduce inflammation and protect memory centers. Pomegranates, these act as circulation enhancers, helping your blood vessels relax and dilate. Apple zella with the skin. The quercetin in the skin shields your brain cells from oxidative damage and stabilizes blood sugar. Kiwi dense in vitamin C and E. Kiwi helps reduce blood pressure and has a low impact on blood glucose. Avocado, nearly 60% of your brain is fat. The monounsaturated fats in avocado help build healthy cell membranes and stabilize blood sugar. A message from the heart. I read the comments on these videos every day, and I hear the exhaustion in your voices. You feel like every food choice is a landmine, and you've stopped trusting your own judgment because of contradictory advice. I want you to know that trying to change everything in 1 week is the fastest way to change nothing permanently. Small, specific, consistent changes are what actually move the needle. Tomorrow morning, don't try to overhaul your whole life. Just do one thing. Drink your 12 ounces of room temperature water. These aren't just lifestyle suggestions. They are the upstream interventions that keep you out of my operating room. Your brain and your body have carried you faithfully for over 60 years. It is time to return the favor by giving them the environment they need to stay strong, sharp, and independent for the years ahead. If this information resonated with you, please share it with a friend or spouse who is struggling to make sense of the noise. It might be the very thing that helps them wake up tomorrow feeling in control again. Take good care of yourself. I'm Dr. Samuel, and I'll see you in the next video.